Hi, this is Jay. Welcome to Bright Ideas. When a child is suspected to have a developmental disability, like the mental retardation, a complete diagnosis of the condition is important. A thorough assessment of the condition is critical in considering a child's eligibility for special education services and/or aid in planning the educational and other services he or she and the family may need. The assessment process covers a more intensive observation and evaluation of the child's cognitive and adaptive skills, analysis of medical history, especially of the mother's condition during pregnancy and other circumstances related to causative factors, and the child's current level of functioning. The use of more than one assessment procedure provides a wealth of information about the child, permitting the evaluation of the biological, cognitive, social, and interpersonal variables that affect the child's current behavior. Here are the three models of assessment used in Western countries. These are the traditional, team-based, and activity-based models of assessment. Number 1. Traditional assessment. In this model, the parents fill in a pre-referral form about the family history and the developmental history of the child. Then, the child and parents are referred to a team of clinical practitioners for thorough evaluation of the child's intellectual, socio-emotional, and physical development, health condition, and other significant information. The members of the team are a developmental psychologist, an early childhood special educator, an early childhood educator, a speech or language pathologist or SLP, an occupational therapist, a physical therapist, a child psychiatrist or clinical psychologist, a physician and nurse, and also audiologist and other specialists contribute their own specialized skills to the evaluation process. The second one is a team-based assessment approaches. Because children with mental retardation often have other problems, it is important to involve a team of practitioners from different areas like the specialist in the traditional model of assessment. The team-based approach is described as multidisciplinary, interdisciplinary, and transdisciplinary in nature. In multidisciplinary assessment, individual team members independently assess the child and report results without consulting or integrating their findings with one another. In interdisciplinary assessment, the members conduct an independent assessment and evaluation individually, and the findings are integrated together with the recommendations. Transdisciplinary assessment, on the other hand, allows other team members as facilitators during the assessment process. A natural extension of this approach is the involvement of the family in the decision-making process. And finally is the activity-based assessment. This model of assessment for young children with developmental delays or disabilities is better than the other models because of parental involvement as well as the development of meaningful, child-centered, positive behavioral supports and activity-based interventions. Assessment findings are easily translated into the child's program plan. The assessment materials have a curriculum and evaluation components and do not require specialized materials or test kits. Examples of criterion reference assessment tools are the Assessment, Evaluation, and Programming System for Infants and Children or AEPS and the Infant Preschool Assessment Scale or IPAS.